Hello, everyone, and welcome to a new episode of Med Speaks. Today, we are joined with a very special guest.
Hi, everyone. My name is Dr. Sabina Rao. I am a psychiatrist practicing in Bangalore, Karnataka. I work at a couple of hospitals. One of them is a corporate hospital, and one is a small secondary care center. I also visit the Indian Institute of Science, where I see students. Hi, Kabir. It's good to be here.
Thank you so much for being with us here, Doctor. So, without any further ado, let's get into the first kind of introductory questions. So,
Sure.
general background information about, before your college life, where did you do, high school and things like that?
Okay. So I did my high school in a couple of places. One of them was Vishakhapatnam, which is now in Andhra Pradesh. And my second half of my high school was in Hyderabad, which is Telangana now. So I did it in two different locations, from primarily 9th and 10th in Vizag, and then 11th and 12th, almost all of it in Hyderabad. Yeah.
Yeah. And these were CBSE, ICSE schools?
So my back then we had CBSE, ICSE, and I think state syllabus. Those were the three options one could opt for. My 9th and 10th was ICSE, all the way from I think first grade to 10th. I did my ICSE, but then 11th and 12th I moved on to CBSE because my plan was to write the entrance exam, the entrance exams for medical school in India.
Okay.
So it seemed like the exams were probably more in tune with what was taught in CBSE than ICSE at that time. That would be in the 1990s.
Okay. Okay. Perfect. Well, that's actually, perfectly gets us into the next question, which was, could you give us a brief overview on your MBBS experience, how it was back then and kind of how it differs to how it is now?
So I will tell you that first of all, we're talking about getting into medical school first, which in itself is a very different ball game altogether. Back then, the early 1990s, there were, for every college you wanted to get into, which were national colleges, you had to write a separate entrance exams. For example, if you wanted to get into AIMS, which is All India Institute of Medical Sciences, they had their own entrance. If you wanted to get into, say, St. John's Medical College, which is in Bangalore, they had their own entrance. And then every state, like Karnataka, for example, had the test CET. So, or you wrote a common entrance called the pre-medical All India test, which is what I wrote. Because of my background and my father was in the military, it was very hard for me to find a domicile of a particular place based on my stays in different states. So it made more sense for me to write an All India exam. So I wrote the All India exam, and then I got a rank, and eventually I got a seat in Bangalore Medical College, which is in Bangalore, Karnataka. And back then you could choose 10 colleges in the medical list, and number 1, number 2, number 3, and so you went down the list, and I chose Bangalore Medical College because I knew the language Kannada. And my second choice was in Mumbai. Hindi would have worked, but I didn't know Marathi very well. So that's how I landed up in Bangalore Medical College.
Okay. Okay.
Yeah.
And I guess now the NEET is a standard entrance exam for all these colleges.
Yeah. Yeah. The NEET, I think, has been around for a few years now. I think they're still trying to make it, I think they're trying to even out the edges. There's some confusion. Some people don't like the way it's set up. Some people like it. I think it's a very good idea. It was very hard back then to go from city to city writing entrances. And for every entrance, you paid 500 rupees, got the application form, you filled it out, you hope it reaches the college. It was a tedious and expensive process for us back then. And, you get in a train, you go to Delhi, then you got on a train, you go to, Pondicherry to write an exam. So it was not easy. So I think for overall, when we're talking about a country that still belongs to the lower middle socioeconomic strata, it would make a lot of sense to me that if there is a single entrance exam. And I'm not thinking of the folks who feel like they're losing money by this proposition, with some arguments on that. So I feel like overall great idea. Obviously, it makes it challenging. You got one exam and you got to clear it.
Yeah.
But I think it's a good idea. Yeah. So NEET is now, but we didn't have that back then. unfortunately, in a sense, writing these entrances don't necessarily give a sense of how smart you are. It's just the test taking capacity of a student. So some people are just smarter than others at taking tests. Some people are better when you get into the theory of things. So it's the only way we have to write, to clear out the ones who don't probably have the aptitude to study and study and study for the rest of their 5.5 years or 6 years or how long it takes. This is the only available option. So it works. It works. I think it's worked for a long time. So unless somebody comes up with something really smart, this is what works for now.
Yeah. And another small, sub question for this is the 4 years of MBBS is for psychiatrists. There's no kind of differences. It's just a standard MBBS.
Right. So psychiatry is something you would do after your MBBS. It's a subspecialty, or it's called just a specialty.
Okay.
And it's about 4.5 years of medical school in India, and then a year of compulsory internship, only after which you get a degree, which we call the MBBS degree. In that time period, you will, at least when we were in training, you would not have maybe more than about 15 days of posting in psychiatry, maybe 2 rounds of it. So there was not much exposure to psychiatry. And so if you were interested in psychiatry, that was your own thing. And so people didn't choose psychiatry. And so very few people even knew of it. And whatever the little bit they knew, that would frighten them.
Okay.
And there was not much. But I know for a fact now that they're increasing the number of hours that a medical student has to go through for psychiatry. It's much better, way more awareness.
Okay.
So things are better. Yeah.
Okay. Well, that perfectly segues us into the next question, which is what made you choose psychiatry? Why psychiatry out of all the medical professions like surgery and this and that? Why psychiatry?
Yeah, the fancy ones. No, surgery sounds the most fancy, right?
Yeah.
Actually, I did think of surgery. So first year of medical school is, pre-med subjects like biochemistry and physiology and anatomy, where you do the dissections of,
Cadavers.
cadavers. Yeah. And then you do microbiology. So you do what are called preclinical, paraclinical subjects. And then you go into actual, clinical subjects where you go to the wards and you see patients in your 3rd year. Okay. And then you start to realize, oh, you know what, this is interesting to me. Somebody likes gynecology, somebody likes, surgery. You don't get much exposure to radiology, and you don't get much exposure to dermatology. Even back then, it was 15 days, if that. Okay. So I did like surgery because that's maximum exposure was to obstetrics, gynecology, internal medicine, and surgery. I thought I liked surgery. I liked it. But, it requires a lot of hours of standing. And I didn't think I had that physical stamina to stand for 6 hours, 8 hours in those, scrubs, covering my face and profusely sweating through it.
Yeah.
And I had 2 options. I had psychiatry and I thought about surgery, and I gave up surgery. I said, this is not my kind of thing for many reasons. Okay. And that anyway, I always had an interest in psychiatry even before I joined medical college. Oh, okay. And so it was just a question. Yeah. So, yeah.
That makes perfect sense. Well, so now kind of talking about psychiatry in specific, after your 4 years of MBBS, how is psychiatry residency? How many years is it? What do you do in those years?
Mm-hmm. So after your totally, it comes to about 5.5 years by the time you finish your medical college in India. So I did all that from India. Back in my day, very few people went abroad. I don't think anyone actually went for medical school or undergrad. Very few did, I want to say. So you write the USMLE, and if you're talking about the 1990s, late 1990s, so USMLE 1, 2, and then 3 also. And back then it was called TOEFL. Now it's called IELTS, I think. And once you've cleared that, you could, the USMLE 3 was in the States.
Yeah.
And there was an order, I think, I want to say it was, you had to do 1 and then 2. I think there is no requirement for an order of when you write the USMLE tests now. And we had to go there and do a clinical skills assessment. So you had a room where you had a fake or real patient. You had to do an interaction with this patient. Now you've already finished your MBBS, so you know how to talk to patient, and you know diagnosis. But what they're looking for is do you know how to interact with a patient to a point where the interaction is respectful, they understand what you're saying. Remember, you're a foreign medical graduate. Now, and they don't know, you could be from Russia, you could be from Germany, you could be from any country in the world coming to your US. So they want to know if you're able to communicate. So then you do that. And then there is this very tedious and expensive process around the month of September, where you start applying for different universities and colleges.
Okay.
So my understanding is in the States, the local American medical graduates don't apply to many, because when they do their final year, they kind of already have done a bit of work with different colleges or within their college with a unit. And so they already know where they want to go. But as FMGs, you don't know. So you kind of apply to wherever you want to live, or, wherever. I was married by then. So we were looking at places where we could afford to live. Like now, if I go, and you can't apply to California as an FMG, it's not easy to get in. You can legally apply, but your chances of getting in are close to nil.
Okay.
So most people apply in the Midwest, East Coast. So then you apply, you fill out, you go to this fancy website and you start filling in information. It's like a thick resume of information. And it takes a few days to fill it out. And then you apply to each college, and then you hope to hear from them.
Okay.
And then you hopefully get a few calls back. So I think I applied to, I don't remember now, maybe about 15.
Okay.
And I think 15, a little more. I think I got a call from about 10.
Okay.
And apparently it's good to apply to universities rather than say county hospitals. You could compare that to a big setup, like, a big hospital with X number of beds, compared to, like, let's say somebody that has a 400 bedded hospital or a tiny little 60 bedded setup. Where would you get better training? So I applied to a bunch of universities because somebody told me apply to universities. So then I waited. Then it takes a few months, and then you start getting interview calls to come and meet the team at the university.
Okay.
So then you have to read a book about how to dress and how to speak, and because you're not from
The place. Yeah. Okay.
As a foreign medical graduate going on a requirement of a visa. So as a resident, remember, you earn money. So you go on an H1 visa.
Okay.
So you have to show a level of experience or qualification, which therefore will allow you to get an H1B visa, which is a very simplistic explanation for a complex process. So step 3 is required before you apply. If you apply without step 3, you won't even get a call for an interview.
So it's really, really hard for, foreign medical graduates compared to students already in the US.
Yeah.
Now that you're in the college, those how many years do you have to do of postgrad?
Yeah. So in the US, psychiatry residency is 4 years.
Okay.
In India, it's 3 years. In the US, it's 4 years. And it starts with year 1, which is almost like a repeat of your internship. So you do 6 months of internal medicine, 2 months of neurology, and then the rest of the remaining 4 months is start of psychiatry. Okay. You start to work in the inpatient units. You are under supervision. Year 2, you start, you might start an OPD, start seeing patients. Year 3, year 4 is a lot of intense work, a lot of sophisticated therapies, a lot of sophisticated cases. Year 4, you can apply for what is called a chief resident position. That is, you're almost like a lecturer, but you're in year 4. You're senior enough to supervise other people, and yet you're still in training. So that's like the nicest fun year where you're looking for a job, and you're also kind of supervising other people. Some people apply to join academics. Some people apply to clinics. Some people apply to hospitals. Pay, if you were to ask about, it's pretty decent even during residency for a single person. Say, even if you're married, it's just you and your spouse or your partner, or let's say you're living with somebody, this is your partner. It's pretty decent. It's at par with the standard of living in the city you might apply to. Like, we were in North Carolina, so not the most expensive place to live. So I had a certain salary as a resident. Say you're living in New York, the salary will go up, and they will also give you some discount for taking apartments. So it kind of works out. It's pretty decent that way. Yeah, it's not bad. And
Okay.
then as soon as you finish residency, boom, your salary goes up way above $100,000, way above, and you start earning pretty good. Yeah.
Say the years of residency are over, uh, what's kind of the differences between being a clinician versus in the hospital or in an asylum?
Okay. So they call the American system where I trained, they don't call them asylums anymore. They call them psychiatric hospitals. And ever since the time of President Kennedy, his whole concept was that we should reduce the number of hospitals where we lock people up, and we should have more people out in the community where they get respectful, at par care with anyone with any health condition. So over the decades, the number of uh, what are called psychiatric facilities have come down, but they're still there. In every state, you do have a few, and every state has its own laws that govern mental health. So you could work in a psychiatric facility like I did. I worked in a state psychiatric hospital called Central Regional Hospital near Durham, North Carolina, in a place called Butner for 4 years after my residency.
Oh,
And I loved it. I mean, I saw some of the most acute patients that had just got off the street because they were having an episode of a psychotic break, or maybe they're very high on drugs, so they're not able to think clearly.
okay.
And they would stabilize so beautifully, and then we liaison with a social worker. I have a psychologist I work with, and then we discharge them to safe community care. That would be a acute psychiatric facility. You could work in a clinic. You would say, you know what, I don't like to see acute patients. I want to see OPD patients. I would rather treat anxiety, depression, social phobia, specific phobias. I don't want to get into this intense stuff. You can apply to a clinic in your town or in your state and work from 8 to 5 or 8 to 6.
Okay.
Or you could say, I'm going to apply to the Veterans Hospital, which is a federal government hospital, and that's more, it depends on where you are. So you can apply there, and it's a 9 to 4 job, great insurance, good pay, supported work, because they have big teams of, that's the good thing about the US is you work in big teams. You have a psychiatrist, you got social workers, you got psychologists, you got those you can liaison with when the patient gets discharged. So you're not on your own trying to figure things out.
Okay. Okay.
So you
And I
got a
guess
clinic, you got
between a clinic and a hospital, hospital patients are admitted, like they don't come in themselves, but in a clinic they come in themselves, right?
so again, it depends. I might say, hey, you know what, I'm so depressed. I really need to get admitted because I'm having these really bad thoughts. I
Okay.
could get myself admitted too. So it doesn't have to be by force.
Okay.
Yeah, it depends. Now, in a facility like where I work, because it's a government-run facility, it's usually the uninsured who don't have insurance, who don't have money.
Uh-huh.
And so these are the people who are sort of disenfranchised out on the street, who don't even know they have a mental illness, not taking good care of themselves, they're not taking medicine. In a private setting, you will have those patients, but there'll be a lot of people who will just come in because they know they're sick, or maybe they know they're having very negative thoughts, and they'll get admitted for that.
Okay. Okay. Well, that was pretty interesting, and I actually did not know before this what the differences between a clinic and a hospital and things like that were. But now, kind of talking about, say, you want to study more, even after your PG, is there like a focused, fellowship type thing you can do in psychiatry?
Absolutely, Kabir. You can do a fellowship in child and adolescent psychiatry.
Hmm.
You can do it in addiction psychiatry.
Oh,
You have geriatric psychiatry, which is the care of the elderly with
the
mental
elderly.
health issues.
Yes.
And you can do liaison psychiatry, where you work in a hospital, which is a general hospital, and you see all their cases which turn out to be psychiatric in nature. So you don't have your own
Oh,
clinic, you just liaise with other specialties. That's what you do. There is
okay.
also, I think psychiatrists are still allowed to do a fellowship in pain, because pain is in under the realm of surgery, medicine,
Medication,
anesthesia,
right.
and psychiatry, because people in chronic pain tend to have a lot of depression and anxiety. So there are some very interesting fellowships one can do.
Uh-huh.
If
And I
if
guess pain, deals a lot with the neurotransmitters, which
Yeah,
psychiatrists also deal with. So it makes
yes,
perfect sense.
yes, yes.
Yeah, that's pretty cool. I guess this liaison psychiatry I'd never heard of, but I've like I can imagine because there are so many patients in actual hospitals who come in with a wound, but actually then doctors find out that there's something wrong with them in their brain as well.
You are absolutely right. It's called consultation liaison psychiatry. So if somebody's admitted, say, a woman giving birth to a baby, and the gynecologist might find out, you know what, she's depressed, she's crying the whole day, she's doesn't want to feed the baby, she doesn't even want to look at the baby. Hey, call in the psychiatrist, let them take a look, maybe they can help her. Forensic psychiatry.
Oh, for
So
crime things.
yeah, so in my hospital we had a separate unit for those who are brought in by the law for crimes, and for us to figure out if these folks had true psychiatric issues or were they just faking it sometimes. So that's
Oh,
that branch too. Very interesting. You can be called as an expert witness.
in specific, did you take any super specialty?
I didn't, I'll tell you why, because I knew I was coming back to India.
Okay.
And so I came back about 10 years ago, and I wasn't sure that there was there was a way for me to do a pure subspecialty, because I felt like it's a country where there are about 7,000 psychiatrists for 1.2 billion people. So I figured I would have to likely do everything. So I felt like I was interested in child and adolescent, but I was like, probably not. Let me just do general psychiatry. And now I see people from the age of 16 all the way to they live to 110.
Yeah.
So you can't really choose to, because there is nowhere else for people to go. So you've got to be able to see everything. Yeah.
Okay. Okay. So now, I guess now in comparison to other medical professions, how does psychiatry in the path of becoming one differ from the other specialties?
Yeah. So I'll tell you what, even in the States, not many people want to go into psychiatry. And I'll tell you why that is, for two reasons. One is people do, even in the United States where I trained, have a little bit of stigma around mental health.
Mm-hmm.
And a lot of doctors um, don't want to have to deal with that day in and day out. A lot of physicians see psychiatric cases every single day. Depression, anxiety patients are primarily seen by primary care physicians. And if the case is very complex, they get referred to people like me. But they don't want to be the only thing they do. So not many people are interested, and it's not the highest paying field. So if you break it down, if let's say back then a neurosurgeon was earning, or let's say a radiologist was starting at $450,000, or maybe a cardiologist, a gastroenterologist, starts at 300, 350,000. I started $130,000. So now, which field would I rather go into, where I can make a lot more money, and my lifestyle is great because I don't have to see somebody who's acutely ill or who might be slightly upset and be using foul language. I might just have to sit in an office and look at x-rays and CT scans, and make triple the money. So very few people would rather go into it, but I think once you get senior in our field, you do make a decent amount of money, but it'll never reach the level. So that's one of the things I think that's a downside in terms of how does it compare. And otherwise, I think lifestyle is great. You eventually can get to a place where you only work so many hours. You anyway you are one of the, you tend to be earning more than most people anyways. It's a question of among the most few people on top, you're not the biggest earner,
Right.
but you still make decent money. So it's pretty good.
Mm-hmm.
Lifestyle is good. You can work in a clinic, you could work part-time, go home, and you don't have to see the acutely sick patients. You see everyday pain, and you could do therapy. I don't want to forget that. You could be a therapist. You could be a psychiatrist and a therapist. You could do cognitive behavior therapy. You could do dialectical behavior therapy. There are so many good therapies out there, and I could be an expert at those and do therapy.
Okay.
Yeah.
The next question I'll be asking is, honestly speaking, as a ex student yourself, how was the education of psychiatry in the US, and how was MBBS? Like people always say, education in the US is top notch and things like that. Is it how they say it is, or is that all just?
See, I don't want to get some, dangerous comments being typed up when your video goes live, but I'll tell you this in my personal experience. My residency training was top notch.
Okay.
I trained from Duke. So
Oh,
I
wow.
graduated from Duke, which at there back then was in the top 10 programs for psychiatry.
Okay.
So in the country. So I guess it was at a level which may not be for other psychiatry programs. I feel like it just prepared me very well for being a practitioner. I think the advantage of studying in the US is they also teach you research. So if you are very keen on research and data collection and things like that, it's a fabulous place. That's why I say big universities that are doing well tend to have a lot of funds for this kind of research. And after the whole COVID pandemic, mental health has become like on top of everyone's list of worry.
Mm.
So funds will be available for that kind of research. So I'm not sure that that level of research is available in India. I'm not saying people are not doing good research, they are, but that funding that you require to do very high level research is not necessarily available. So that's what makes the kind of funds that come into these universities in the US is in millions of dollars. Obviously, when you have money, you can bring in the best. You
Yeah.
can bring in the best equipment. So of course you're going to have a level that's above. So, but where we are as a country, I think we're doing very well. We got a long way to go, and it takes money to get there. So yeah, if you have if you have chance, then see the undergrad in the US, which is pre-med,
Mm.
is when you start learning about research and you start looking at different things. So you get a lot of things done even before you join med school.
Yeah.
And of course, it requires a lot of money, and not every university is good. I'll tell you
Yeah.
another interesting thing about the US is every university is not wealthy.
Uh-huh.
Most universities, there are private universities and public universities. Public universities are funded by the government. Private universities fund themselves. And not all of them are good. Some have good money, they're stable. Some are not good money and they're not stable. So that's another thing to think about when you apply for a program.
Okay. And I guess, you were talking that you were saying that money is, they have a lot of money, and that's why they have the top-notch equipment. They have top-notch teachers to teach the students but then if there is top-notch equipment and top-notch teachers, you're gonna have to pay top dollar. So I guess, the education is really good, but you have to pay for it.
Yeah, someone's got to pay for it, so the students pay.
Yeah.
I mean, if you're an in-state student, like if you're from the state of Ohio, you've done your 12th grade there, then your in-state tuition, if you join, say, uh, Ohio State University, maybe way below that of a foreign undergrad student who lands up paying quite a bit of money, which funds the whole college. Basically,
Yeah.
you're funding the college.
And
Yeah.
coming back to the research bit, now, like for high school students, colleges look at your application and see if you've done research in high school itself. And if you have, then they look at that really, with a bright shine in their eyes. And
Yeah.
it's very, very much valued if any that sort of research has been done in your high school years.
This is true. This is true. They want you to be on top of your game. So if you're somebody that's not really interested in pushing it and kind of keep the engine running and keep it running at fourth, fifth gear, then it's not something you should do.
Yeah.
It's pretty tough out there. I think there's a lot of students, it's a little bit of a state of enamorment, if that's a word. Even it's very glamorous to go to the US or the UK or Germany or wherever else
Right.
people want to go, especially in the US. And that's the only thing I can speak of, is it's only until you get there and suddenly you have to wake yourself up at so and so time and get to your class. Ain't nobody waking you up,
Yeah.
and you have to maintain your GPA. And if you don't, your parents will get a call when they say, hey, come. They won't even call the parents, they'll say leave, because you're 18 and above. They will not send the GPA scores to your parents.
Uh-huh.
So it's a whole different ball game. So if the kid is, if you as a student are not interested in, in this kind of desperate grind for years and years and years, then do not think of it. There's a lot of good subjects out there one can take.
Yeah, and I think studying abroad and studying medicine are pretty, intertwined in the sense that they are both they require a lot. You need to sacrifice a lot. You need to give a lot of your time. Say it's an international student going abroad through high school, they have put their all into going abroad. Then abroad, they have to put their all in med school to, do good and keep going, and then to get into a good residency program. And then in the
Yeah.
residency, you have to do amazing to get a good job. And then I
Yeah.
guess, you can relax for a bit.
So by the time an actual doctor in the US starts making money, that's 4 years of undergrad, 5 years of med school, 4 to 5 years of residency. So that's 5 plus 14 years. And let's say you decide to do a subspecialty or a super specialty, that's 3 years more at least.
Hmm.
So 14 plus 3. And
That's
then you start making a bit of money.
more than the years I've lived on this planet.
So there you go. There you go. And a lot of money spent. So forget the number of years. Don't forget you're putting in truckloads of money. So you better be sure you want to do it.
Yeah, and it is definitely it can be rewarding.
Yeah,
We can put
absolutely.
it. It can be very
Absolutely.
rewarding. So
Absolutely.
on the topic of money, let's talk about the pay of psychiatry and how is a lifestyle like? Is it a balanced lifestyle? Is it really a grind? And how does it compare from India and the US?
Okay. So I practice there and then I practice in India. I think, like I said to you before, the earning capacity of a psychiatrist is very good abroad in the US. I was very comfortable with my starting salary. I was still very young, and I had a family already, but that money was absolutely fine. Even if my husband wasn't earning, it would have been perfectly fine for me to earn myself and bring up 3 kids. Would not be able to send them to fancy schools, but then, everything is state run there. Your
Yeah.
kids go to state run schools. Some people like to spend a load of money on private schools, but most kids go to state run schools. So that's good enough, right? I mean, I start at a salary where I can run a family.
Of three.
That's a lot. Of yeah, I have 3 kids. So yeah, of 3 kids, I could, and my husband was earning. So obviously that's great. So we were very comfortable. The lifestyle is also fabulous because obviously you're earning well. So you can even buy a house. Now I'm not talking about San Francisco, or I'm not talking about the Bay Area. I'm not talking about those areas which are $2 million homes. I'm talking about North Carolina, $350,000, 200, the beautiful big houses. And so I'm happy. I mean, I've got a family, I got a house, and I got a job.
Yeah.
And I decide to work. And I'll tell you this too. I was given the opportunity to work part-time because I had 3 kids. And I still earned very well. So I can't imagine that in India, where I can earn well enough to support myself and my family in a city of Bangalore and work part-time. Forget work full-time. I don't earn enough to survive for myself in this city.
Oh.
So, so I think there's a dramatic difference between the earning capacity of a doctor here and there. Here, doctors work on weekends. It's very sad to hear. People will call and say, "Don't you work on Sunday?" And I'm like, "No, I don't work on a Sunday. I have family, What about that?" So here, doctors work on Saturday, they work on Sunday, they work all day. They go home at 7, 8 in the night. So that's not a good lifestyle. But that's what they need to do to earn enough money to support a family. Can you believe it? Just basic family support.
But I mean, it makes sense because you might be earning double in the US, but you are paying half here to study. So it's kind of
Mm.
carries
It
balances
balances.
it out.
Yeah.
Yeah. Maybe I am wrong, but I've heard the working condition over there is way better than here because a lot of the times, one doctor I interviewed, didn't have enough hospital beds during his residency year. So when he was having to work 24 hours, he slept in his car outside the hospital. So things like that. I mean,
Yeah. Yeah. Rat infested hostels. Um, yeah, I've seen a lot of, I've seen things in my government hospital that it shouldn't be that way, but it is. Again, it's all about the economics of things. One upside that I'll tell you about the medical health system in India is that you can access a doctor anytime, anywhere. You can never access a doctor anytime, anywhere in the Western world.
oh,
You will never be able to talk to your doctor unless they're actually working that day. Say, if I have a crisis, I have to go to the emergency room and that's it. And if it's just a stomach ache and not a heart attack, I might have to wait 6, 8 hours before a doctor will see me. And I don't
oh,
get to choose where I go. I have to go to the place which my insurance covers. If I go to emergency room, sure, I can go wherever I want, but I might get a bill of $2, $3, $4,000. That's a lot of money to pay out of pocket. So access to care in India is, I think, much better. You look at Canada, you look at UK, the waiting times are unbelievable. I can just go to the nearest lab and do some blood tests because my doctor said, hey, get your thyroid checked up. You might have to wait weeks and weeks and months to do that in some countries of the world.
Yeah, and
So
like here, my family doctor here, there have been so many times where when he's sleeping, I had a really bad stomach ache when I was 8, and like at 11 in the night, my mother called him up, and he did have this medicine, had that medicine, and I was fine. I doubt that would ever be possible
no, yeah.
abroad.
You either land up at an emergency room or you speak to the nurse practitioner and she can tell you what to do. But if you're looking for your doctor, come tomorrow with an appointment to see your doctor.
That was very, eye-opening, the differences between
Mm-hmm.
abroad and here. Coming towards the final questions of our evening today, what do you think are like a couple of the downsides of being a psychiatrist? I know throughout the questions that we have asked, there it has been answered kind of vaguely, but what if you were to tell me?
I think the downsides would be it's a tough profession to be in. Although most people get better, there will be a small. It's most a lot of it is I'm being trying to be careful the words I choose because I want to be right the way I say it. Some of the illnesses are chronic and they don't go away, and these people have to be under your care for a really long time, if not a lifetime. And some of those illnesses have pretty heavy duty medicines and they can make you gain weight, they can cause diabetes, and it's hard to see these people struggle. It's hard to see people go through loss. It's hard to see people struggling, suffering, sad, depressed. It's hard.
Yeah.
And very rarely do I get from the patient directly, who I would have, say, petitioned the patient and got them into the hospital. Thank you for petitioning me, getting the cops to come pick me up and take me to the hospital. Now, if you have a heart attack and you save your patient, the patient's like, thank you, doctor, you saved my life. That doesn't happen very much for us. So, and very few people will say, hey, doc, that's my psychiatrist, at there in the grocery store. They'll say, hey, that's my cardiologist in the grocery store. They won't say that about, nobody wants to be known as somebody, I'm seeing a shrink, I got crazy things in my head.
Yeah.
So those are some of the things, but
Mm-hmm.
it's okay. Those are the downsides, and it's tough work. So if you're going to be a psychiatrist, you have to think deep and hard if you want to do it. It's hard work. It can be exhausting mentally and physically. But when people get better, it's fabulous.
And I guess psychiatrists are kind of the unsung heroes of the medical world because no one really talks about them, and it's like people have a stigma against going to psychiatrists or psychologists or any sort of therapy, if for that matter.
Yeah, mental health professionals. And for some reason, across the world, there's this belief that this is all a mind thing and that therefore you have control. And so it's all about strength and weakness. It's not the mind thing. It's all in the brain. It's the way the wiring is, the way the neurotransmitters work.
Yeah.
And so you can't have it all in your control. Sometimes you need help, just like any other condition in the body. And the way people realize that the mental health issues are as medical as any other issue in the body, I think things will change in the world.
Yeah. Has someone else's condition ever made you like bogged you down? Has any patient ever had like a impact on you?
All the time. I have plenty of patients who have impacted my thoughts, and I've had plenty of patients I've learned a lot from.
Oh.
And I've had plenty of patients who I've had a very deep, absolutely lovely connect with. So they will always be patients to me. They will never become friends. They'll always be my patients. I'll always have a professional relationship with them. But I've had great connects with them, and I've had amazing experiences, and it feels horrible sometimes to see some of my patients struggling, and it sometimes gets you. That's why you need somebody else in your field that you can talk to when things are not going, who reminds you, hey, this is your profession. Take a step back, reassess it. So yeah.
Yeah, and I think I definitely think looking at things from the point of view that it's mind, and kind of detaching yourself emotionally is a skill a lot of psychologists and psychiatrists have, which is why they're so successful.
Yeah, I think you're absolutely right. You're talking about what's called cognition.
Yeah.
Looking at something differently is cognition. It's the crux of mental health.
Uh-huh.
And if people knew the trick about how beautifully it works, like you said, it changes outlooks.
Yeah,
You're right.
I think that's really cool about this
Yeah, it
field
is.
itself. So
Yeah.
now, to end our evening on a high note, what are the benefits of being a psychiatrist?
I think it's more to do with benefits of being a doctor.
Hmm.
You help people. People are grateful when they get better, and that makes you feel really happy for them. You get a lot of blessings from people. You know, people
Uh-huh.
wish you well, even
Yeah.
if they have mental health issue. Like I said, sometimes they are very upset when you get them admitted, but a lot of people wish you well, and it's always good to have some good wishes come your way. It's always nice. The brain likes um, helping people. Just to get back to cognition, it's one of the things about the evolution of the brain. It likes to help people. So that's, if you're doing that day in and day out, it's very gratifying at the brain and mind level, at the level of who I am as a person, as well at the level of my brain. It's very gratifying. um, I wouldn't do anything else. I wouldn't know how to do anything else. This is the best I do. This is what I like to do. So being a psychiatrist is what I enjoy. I'm I'm able to do it decently, and people get better, and that's always nice. That's always
Yeah,
nice.
I definitely think for all the, things that can be bad in the process of becoming a doctor, money, things like that, it's such a noble profession at the end of the day, and it's so highly respected, and I think it's the best. I don't think it gets better than that. Well, thank you so much for taking out time and being with, joining us here. I'm sure a lot of kids my age and people have learned a lot from today's session. So I'm thanking you on from their behalf and from mine. So thank you so
Sure,
much.
Kabir. Thank you for having me, and all the best on what comes next for you. All the very
Thank
best. Keep me posted.